The new U.S. food pyramid marks a significant shift from decades of nutritional advice. The inverted design places red meat, dairy, and vegetables at the top, while grains and bread move to the bottom. The plan focuses on whole foods and cuts back on processed and sugary items. Health Secretary Robert F. Kennedy Jr. says the goal is to get Americans eating real food as part of his Make America Healthy Again initiative. But the change is sparking some debate, and to break down what all of this really means, we're joined by registered dietitian Jessica Cileo. And so, Jessica, thank you for being with us this morning.
Absolutely.
I want to start off by asking you, what does science say about this new food pyramid?
Oh, that's a great question. That's a big question, actually. So the biology is still all the same. The biology hasn't changed. You still need oxygen, you need water, you need food, you need sleep, right? And to break down the food, you need fats, you need carbs, and you need protein. That is all the same. The guidelines are just guidelines. So they have changed to help us guide the way to hopefully more of a sustainable future, to start looking at some of these chronic diseases that are metabolic. And so the science, there's tons of science out there, and the new guidelines help us just focus on some of the good stuff.
What do we make of the emphasis on beef and saturated fats?
Sure, that is the topic everybody wants to talk about. So saturated fats, that number hasn't changed. They still want you to not consume more than 10% of saturated fats in your total diet per day, of your calories per day. That number is the same as the previous guidelines. So what has changed is they've introduced, basically saying that in a moderation, you can have some saturated fats, and within a healthy diet, that still may look okay for some people.
What could this mean for heart health in the future?
Sure. Well, again, the guidelines really haven't changed from last year. They're still saying stay below that 10% of saturated fats. So because of that, that hasn't changed. They are still focused on your heart health and adding in more vegetables and fruits. I don't know if you noticed that, but they're right up there at the top too. And focusing on those are really what's going to help promote that heart health.
And so they also updated the alcohol guidance and removed limits on drinks. Just take a listen.
So alcohol is a social lubricant that brings people together. In the best case scenario, I don't think you should drink alcohol, but it does allow people an excuse to bond and socialize, and there's probably nothing healthier than having a good time with friends in a safe way.
Now the question is there a correct limit on the alcohol we should be consuming?
I don't think there's a correct limit, because alcohol just hasn't been researched enough. There just isn't enough correct research to hone in on what the proper amount is. And again, it's all individualized, so we have to keep that in mind. In previous guidelines, it was 1 drink per woman per day and 2 for men. But again, they just say they recommend less. That's what these current guidelines are, just less. So that is broad, but however, there is just no good evidence-based research out there right now to say exactly how much each person should have.
And the final question is for parents at home that want to apply this to their children. What is some advice that you would give them?
Yeah, stay away from the ultra-processed foods, the things that can sit on a shelf for 5 years at a time and not change. Those things we don't want to put in our body, because they're going to do the same thing in their body. They're not going to change. And we want our foods to be whole foods, less ingredients. So if you find something, look for the less ingredient item out there. You want whole foods. And that's what these guidelines do a good job at promoting, is that you want the whole foods on your plate.
Awesome. Thank you for being with us. We appreciate your time.
Absolutely.
We're going to continue right after this break.